Good afternoon. My name is Linda Southward, and I have the honor of serving as the Executive Director of the Children's Foundation of Mississippi. We at the Children's Foundation believe that for Mississippi to reach its potential, we must make sure that our children reach theirs. One of the ways that the Children's Foundation elevates important and timely topics impacting children and their families is through our Chat About Children survey series. Today, we cannot think of a more timely topic than the impact of COVID that it's having upon children across Mississippi. And so today, the Children's Foundation is extremely honored to have several well-known pediatricians across Mississippi and well-known beyond Mississippi. They are Dr. Jonathan Shook and Dr. Tami Brooks. And later, we'll have Dr. Tanya joining us. But if you allow me to go ahead and introduce all three. So Dr. Jonathan Shook is from Jackson, Mississippi. He's a graduate of Mississippi State University with a degree in biological engineering. His medical degree is from the University of Mississippi School of Medicine, and he completed his pediatric residency at UMC. Since 2006, he's been practicing pediatrics in Hattiesburg, Mississippi at the Pediatric Clinic, a service of the Hattiesburg Clinic. Through his experience as a pediatrician, as well as father of 4 of his own, Dr. Shook has developed a passion for helping children with learning and attention challenges. In 2016, he joined Hattiesburg Clinic Connections, a multi-specialty group of clinicians to evaluate and treat children and teens with learning and behavioral differences. Dr. Shook has a special interest in caring for children and teens with ADHD and related conditions. Dr. Shook has been a dedicated advocate for children's health by being a part of multiple professional and community organizations. He served as president of the Mississippi chapter of the American Academy of Pediatrics in 2016. Dr. Shook's hobbies include attempts, that's what the bio says, attempts to play golf, audiobooks, especially biographies, and driving his kids thousands of miles in his minivans, affectionately known by friends and family as the Daddy Wagon. Okay, next, Dr. Tami Brooks is a pediatrician who's working part-time, and I still will believe it when I see it, part-time now with Physicians and Surgeons Group in Starkville and with Avancic Pediatrics in Tupelo, Mississippi. Prior to that, she had a stellar career in academic and clinical pediatrics with University of Mississippi Medical Center for more than 20 years, and around 30, including her time as a resident student there, but she retired approximately a year ago. She also graduated from Mississippi State University. It was in 1989 with a degree in biological sciences education and her medical degree from University of Mississippi School of Medicine in 1993 and completed her residency in pediatrics in 1996. During her time with UMMC Department of Pediatrics, Tami worked on a part-time basis as medical director for children's issues with the Mississippi Division of Medicaid from 2015 through 2018, excuse me. Tami's been a longtime advocacy chair for children's health in Mississippi, serving as chair of the Mississippi chapter's AAP, Academy of Pediatrics Committee on Advocacy, Governmental Affairs for over 15 years. Tami and her husband, Carl, live in Starkville and are the parents of 2 college-age sons. I'll go ahead and introduce Dr. Tanya Fitz, who will soon be joining us. She is a physician owner of Lafayette Pediatric Clinic in Oxford, Mississippi, became president-elect of the Mississippi chapter of the American Academy of Pediatrics last year, and she's set to assume the role of president of the organization in January of 2022. As president of Mississippi AAP, Dr. Fitz will be responsible for advocating on behalf of pediatricians in Mississippi at both the national and state level and promoting health and wellness for children. Dr. Fitz has noted that a large focus of the role for both this and the coming year, which of course we'll be talking about today, will be addressing issues related to the COVID-19 pandemic. As a native of Pontotoc, Mississippi, Dr. Fitz has been a member of the American Academy of Pediatrics since 1999 and has helped lead efforts to improve access to healthcare for children in underserved areas. She completed her undergraduate work at Vanderbilt University before entering medical school at UMMC residency, and after completing her residency in pediatrics at Batson Children's Hospital, she joined a practice in Oxford, where she eventually opened her own pediatric clinic in 2007. In 2019, the Mississippi Business Journal named her one of the state's top 50 leading business women. She resides in Oxford with her husband, David, and twins, Anne Claire and James. So again, welcome. When we think about children in general, we know that parents are children's first and most important teachers. We also know that children's parents and caregivers are engaged with children's education through their teachers, but then also certainly with their children's healthcare providers, specifically pediatricians. And for the audience, we know that pediatricians treat children, infants, and adolescents. You're all trained to meet the unique needs of children through all their developmental stages as they grow and mature. You spend clinic time in assessing where children and youth are, and also spend time through some, I think you call it anticipatory guidance. My understanding of not only where the child is now, but where parents and caregivers should expect that they would be between now and the next visit. All that would have been full-time enough, and it was. And then you bring on what you and we all have been experiencing in more than 1.5 years now with the pandemic. So that's the particular area that we want to focus on today. So we very much are grateful for you making time to share with the audience some of these sort of broad areas, what you're seeing and experiencing in your clinics at the local level, information about the vaccine that's now available for older children, as well as maybe what's on the horizon for younger children. We also want you to help us separate the facts on COVID in children. What maybe are some of the misconceptions out there from what you're hearing in the clinic, and then the impact of COVID on school and children's development. So that brings us to the first question. As the number of COVID-19 cases are increasing across the state of Mississippi, what are you seeing in your practices now, and how are these young children presenting? Just kind of help us, give us a visual look of what this looks like in your clinic.
Well, I'll go first. We're seeing lots of parents much more anxiously bringing their children in with out from exposures at daycare and now at school, of course. So every cough and or fever, there is that fear among the parents, which was a big difference in what we saw with the original surge. So we're seeing many more visits. This, as we know, this Delta variant is much more contagious. So we're seeing it impact our children. I think I saw where the cases now are comprised of 20% of children contracting COVID. So that's a big change from last year, or early, even the last peak that we saw in the winter. So we're seeing more cases. Recent studies have shown that we were concerned that COVID was more virulent, if you would, or severe among children, but preliminary studies are showing that it's the community spread, and it's so much more contagious that we don't think at this point that it's necessarily more severe. But just by that increase in the contagion of the virus and the community spread that we see in our state, we're therefore seeing more kids hospitalized and more in our clinics. So there's that fear. Then there's that, oh my gosh, what do I do with my other 2 or 3 kids? And what do I do about work? And I've said it's not only an epidemiological study and approach to the classroom, but it is to households. So that's been a big challenge. And then at the same time, to think, when we lived in our bubble last winter, we didn't see RSV, adenovirus, enteroviruses and all, because we lived in this bubble. We were masked, we didn't get out much. And now all that's changed. So we're seeing this appearance of all these often wintertime viruses like RSV that are now peaking in the summertime. So as I said, they're kind of been hiding in the bushes, waiting on us leave our bubbles. And so you've got a big mix of things to differentiate between with these children.
So one of the things that we know from last year, this happened nationally, and it was my understanding also in Mississippi. Dr. Brooks, you talked about being in a bubble, and so adults, and certainly adults who are caring for children, that there was a decrease last year in the number of well child visits across the country. But now I'm also hearing you say that some of these other viruses that had been sort of at bay are now also back. So how crowded are your clinics these days?
Well, we are much more busier than last year for certain. And depending on the location that I'm working in, you know, and the resources and the population, I mean, super busy. And so much in Tupelo, we've opened up an additional testing site. So definitely, and then we're back at work, we're back at school. So thankfully, those children are getting back in to get updated on their vaccine so they can start school and hopefully stay there, as well as daycares. Or we're feeling a little bit better about things up until this surge. So we have been super busy compared to last year with the combination of, and then managing our well visits, you know, and trying to be safe and separating those children from those who are sick. So definitely a big uptick in the number of visits for all comers.
I would agree. We've been very busy, really since about March or April of the, you know, when springtime hit. I'd like to just highlight, you know, what the Delta variant is, because I know we use that term a lot, and a lot of parents,
yes, please,
and families might not understand that, because it sort of has changed everything. I mean, everything we're talking about is really a result of the Delta variant. So, the original virus that causes COVID was found in China, and, you know, has since spread to cause a worldwide pandemic. And, you know, all that started in March of 2020. And, you know, during that time, there was relatively low numbers of viral spread compared to later in the pandemic. So early on, there were not really a lot of variants that we knew about. But as the pandemic has gone on, the virus in certain areas has mutated and caused these variants. And sometimes the variants are minor and we never even know about them and they go away. But sometimes the variants can be more concerning and spread easier. And so this Delta variant has been one of those that's been concerning. So it really started spreading widely in the early summer, like May of this year, in different areas of the world. And it came to the United States this summer and has ramped up. Cases in every state has gone up, but we've seen it affect the areas of the country with lower vaccination rates the most. And our state, Mississippi, has consistently been one of the slowest to take up vaccines. And so that has made our state a hotbed for the Delta variant. And so we've been seeing so much more transmission in kids and adults, mainly unvaccinated, with the Delta variant. And so the variants of COVID that were going around last winter did not really infect kids nearly as much. And so we didn't see much in our clinics, a few cases here or there, but people were wearing masks and staying home more. And so as a result, we didn't really see a whole lot of other illnesses in the winter, specifically flu. We didn't have one positive flu test that I heard about in my clinic last year, and which was the first time in 15 years that has happened. And we just weren't busy, talking about how busy we've been lately. I mean, we were sitting around in December, January, and February. It was the most odd winter ever. And we attribute that to people wearing masks, isolating from social events when they can. And so, that's to me evidence that masks work in children, especially in school, because they were going to school in person, most of them here, but they were not getting sick with flu or RSV or stomach bugs or the routine viral stuff that kids get. But then as things started to improve with the cases dropping, people started going out more, doing more things, not wearing masks as much. Our statewide mask mandate came away. And so we started seeing more illnesses in general. Really about April or May, we started seeing outbreaks of RSV unseasonably, because that virus is usually more of a wintertime virus, but we've seen spring and summer RSV more than we ever have this year. And then our other routine viruses like hand, foot, and mouth and stomach viruses have all been really big the past few months. And so we have been busy in the clinic, and it's not all COVID. As a matter of fact, it's mostly other stuff, but just the fact that we are seeing more COVID than we did last year, it does drive up the concern and the anxiety with our clinic staff and our patients as well. But I'm sorry, that's probably more than you wanted to hear, but that was just kind of what I was thinking about.
This is so important, and I know Dr. Fitz will be joining us soon. And while she's joining, perhaps we could talk about what are some of the most frequent questions that you're asked by parents and grandparents or guardians of who bring the children in. I think earlier there was a point made about that there's an anxious level, even though you say that the majority of children who are being tested are negative, but there's still, until you know that that level of anxiety obviously is there, and then how that impacts. And I know Dr. Fitz had talked about this in an earlier communication, but how this is impacting children in school and how often they're can be there in quarantine and those sort of things. So we'd love to hear each of you talk about that as you'd like.
Dr. Brooks, would you want to go first on that one?
Sure. Well, I just, again, they kind of present the history, which often there may or may not be an exposure. And then I just recall the one I had last week, a young 5-year-old, and the dad brought him in, and there was fear in their eyes because the child looked sick. You know, he had 103, 104 fever, you know, not as so much as they have a mild cough and no fever that we still see positive tests from. But this child looked a bit sick. And when we got it was, as we say, turned positive fairly quickly. And dad was on the phone with mom, and she's like, oh no, what do we do? You know, and that's something every parent wants, to be able to do something for their child. And you have to just pull out your old virology 101. This is a virus. We don't have a real treatment under the age of 12. We can talk about monoclonal antibodies later for those over 12, but to treat the symptoms, and most importantly, to tell them what to look for, you know, as far as increased respiratory symptoms, work of breathing, and unable to stay hydrated, those things. There's not a lot for us to tell them to do, but treat the symptoms and what to look for, you know, and what to call us back for. That was the big question, you know, what do we do?
And please talk about the isolation piece and the quarantine piece, especially if there's other children in the household, and how does that work?
I'll take a shot at that one. Sometimes the terms isolation and quarantine can get used interchangeably and confuse people. But
yes,
the main difference in the terminology is that isolation is for people who actually have tested positive, who have the disease, have the virus, whereas quarantine is for people who have been exposed to the virus but don't necessarily have it or don't know they have it. And so, the most recent thing I've seen from the CDC has said that if you have the virus, then you need to quarantine 10 days from the beginning of your symptoms, or isolate for 10 days from the beginning of your symptoms. If you don't know when your symptoms begin, or if you're asymptomatic, then whenever you test positive, they say that would be day 1, and you go to 10 days of isolation from your positive test for the isolation.
So I'm also wondering about, as you see children come in your clinic, and it's my understanding that the older a child gets, the less likely they are to be in a pediatric clinic, right? I mean, you're going to see a lot of the infants, babies, toddlers, younger children, but as they get older, they may not be at the pediatrician as much. But a 12-year-old child, and that's the magic age right now for the vaccine. Would y'all talk about how many or what percentage you're having of older children who can take the vaccine? What does that look like? Dr. Fitz, might you start with that? Start us with that part of the discussion.
So children who are age 12 and over are able to get the vaccine. We have had some serious vaccine hesitancy, more so even than we've experienced with measles, mumps, and rubella in the past, just because of the vast amount of misinformation that's been in social media. This vaccine has been developed fairly rapidly, but has been extensively given, more so than any other vaccine at this point in history. And we know the side effects, and we know that it's not going to last a couple of days. And we know after millions of doses, of if there's any rare things, and we do know a couple of rare things, right? We do know sometimes like 30 in a million chance of developing a myocarditis that is mild, temporary, non-life threatening. Because myocarditis or inflammation of the heart is a side effect of COVID, which leads to problems in the hospital, ICU. These are the kids who are in the ICU, and you're much more likely to develop COVID myocarditis than you are to have the vaccine-related mild myocarditis. And so we do know that, and that's the main symptom. There's a lot of misinformation out, and I don't want to repeat them. It doesn't cause, any problems with fertility. It's not going to integrate into your DNA. It's, anyway, there just is no real reason not to get this vaccine. And for kids who are 12 and older, once they're fully vaccinated, that makes a huge difference in missing school if they do get exposed. And I pushed that this summer, and I think our parents are seeing it now, where I've had several patients who've been exposed twice at school, and they have missed 2 10-day periods. So they've been at school 8 days since school started, of the last 4 weeks. They just have been in school for about a week and a half instead of, the full 40 days. So
go ahead.
I think that's where we can make a real difference. And we also know with the Delta variant, that is much more contagious than what we were dealing with last school year. And so we need to be incredibly careful. Households are uniformly getting it. Everybody in the house gets it. I had that this weekend where the dad got it from a work exposure, and then all 3 children had it. So that's one of the things we need to be really pushing is the vaccine.
And then could be so easily spread to grandparents or others within the household or within the neighborhood too. It's because of how contagious it is from a lay perspective here. But one of the things you just mentioned, Dr. Fitz, is having 2 stints of 10 days absentees. When you think about that, I know a few years ago with Kids Count, there was a study on chronic absenteeism of children in Mississippi. And chronic absenteeism, by definition, is missing 10% or more of a whole school academic year, which is around 180 or 190 days. So what you've just described, if a student is out 10 days or even 20 days. And here we are, we have just ended the Labor Day holiday. That's a huge impact just by the absenteeism alone, not to mention any other sort of emotional and developmental pieces that are there. And I hadn't really thought about it in those specific terms until we really are thinking about that in those terms. So that's an excellent point, as have been excellent points by Dr. Brooks and Dr. Shook already. So what are you hearing about? We've talked about children over 12. What are you hearing about the availability of vaccines for younger children? In the media, we've heard a few dates out there, but just not sure. What are you hearing from the CDC or American Academy of Pediatrics on when a prediction on when that might be available?
Who wants to go? So earlier in the summer, it was going to be October. And then I know that they're doing a lot of work on the correct doses for children under the age of 12. And they called for more study participants. And so the latest we've heard is midwinter. And if midwinter, whatever that means for you. So
hopefully before spring, maybe.
Hopefully before spring, maybe late January, early February. Don't you think, Tammy? I don't know.
Well, yeah, I agree. I did read something that was a little more up to date from the Academy today that did say that Pfizer was supposed to get their information from their trials for age 5 to 11 to the FDA in October. But again, we know how long that could take then to get the full approval. So yeah, midwinter, I think, before we're administering it.
And you, by this point, have admitted children to a hospital with COVID, or even to a different level hospital, perhaps, than where you are. Are there some things that you can share? Obviously confidentiality, but just how this impacts a family when a child is hospitalized and what that means?
I'll take this one. I'm in the Hattiesburg area, and so we have a fairly large hospital here that where we do service a large many counties around with kids, and then our kids that get really sick we send to the Children's Hospital in Jackson. We definitely have seen since the Delta variant started going up in July an increase in our hospitalizations with kids with COVID. Thankfully, the kids that we have put in the hospital have been relatively mildly sick. I mean, they've been sick enough to be hospitalized, but they've had things like dehydration or some respiratory issues that needed some treatment. But we've been able to, treat them here for the most part. I know we've had one child that had MSAAP, which is the multi-system inflammatory syndrome associated with coronavirus in children. And we had one child who was very critically ill and had to be airlifted to the Children's Hospital. And so that was traumatic for that family for sure, and traumatic for us to go through too, because it was kind of scary, very scary. But thankfully that child has done okay and is recovering still. But so the majority of the hospitalizations we've seen, like I said, it have been on the milder end of hospitalization. But then again, we never know when we're going to have that really sick child to come in. But if anybody else wants to share what they're
because sadly we have had children die in this state due to COVID.
Absolutely. Just by the numbers, we know more infected, more hospitalized, and therefore we know, unfortunately, we are likely to see more deaths, and we have just in this summer seen more than, are approaching as many as we saw the previous 9 months, I guess, 9 to 12 months of the pandemic. So, and then I had, was able to admit locally and without transferring a child who was a 12-year-old who had not been vaccinated. and was more of a rule out the Missy because of some cardiac symptoms that were persistent. So that fear, of being transported potentially to another town 3.5 hours away, and was quite frightening. And to know that these odd symptoms that we don't see in children associated with that MISC, that complication, is very frightening. And we know we probably are going to see more of that because that is more of a latent effect from COVID. So we see that usually with at least 2 to 4 weeks after infection. And many times the children may not be aware that they were even infected with COVID. So that's something that's lurking in the backs of our minds often, especially since school started, what we're going to be seeing more later this month from those infected when school started.
Yeah, I'll highlight on that too. I mean, like Dr. Brooks said, that inflammatory syndrome happens usually several weeks after the child has COVID or is exposed to COVID. The child that I was talking about that got critically sick never knew that she had COVID. There was a close family member who had COVID about 5 weeks before the child's severe illness, and so we all assumed that that's probably when the child was exposed and had an asymptomatic case of COVID, but then weeks later got critically ill with this inflammatory condition. So we have to kind of be watchful of those two different waves of the illness. You have these sort of acute illness duration, and then you can have that post-illness inflammatory syndrome that can be very scary.
And let's talk some about wearing masks, because earlier in the conversation, Dr. Shook, you talked about not seeing as many viruses last winter when more people were staying in more and were masking, but certainly that has changed through the month. So tell us about the importance of masking.
Well, certainly, we can all speak to that because of what we experienced last year. And we are just baffled that with such a much more contagious variant, why we would change those mitigation efforts in any way this year. And we actually have some data. There's a study comparing an unmasked school where masks were optional to a school in North Carolina and who did require masks. And the numbers were just in great support that masks prevented infection and transmission in the schools. So we have that data now, and we still unfortunately have school systems who want to look at their own data, if you will, gather their own evidence, if you will, and make their own decisions that are not supported by the public health officials and data that we have from other schools. So that's been quite disheartening, and therefore, anecdotally, when I see these kids, I do tend to ask, do you wear masks in your schools? And it seems often they do not, and especially where I see a very large rural population, or they didn't start out school in masks, but now they do because they had such a surge in positive cases. And so now they're doing that. And sometimes, unfortunately, just for another 2-week period or so till they reevaluate the numbers, if you will.
Thank you, Dr. Brooks. I think Dr. Shook, you may have a graphic to share with the audience.
Sure. Let me see if I can attempt to share my screen. I thought this was a great graphic. So this was a study that was published recently in the New England Journal of Medicine. And so it compared a large group of people who had COVID vaccine and then may have had a small number of adverse events, but then it compared them to a larger group of people who had the virus, had the COVID syndrome after the SARS-CoV-2 virus. And so if you look in red, so these were the people who had COVID-19, they were sick, And these are the complications they had. And these are extra cases per 100,000 people. So, and that may be hard for some people to understand who are not medical, but you could look at, say, a heart attack, which the medical term for heart attack is a myocardial infarction right here. And so you'd say, well, gosh, out of 100,000 people, in a given time period, a certain number of people are just going to have a heart attack randomly. Well, if you get COVID, there's going to be 25 more people that have a heart attack than the background rate. And if you look at compare that to the vaccine, there's one extra case of myocardial infarction compared to the background rate with the vaccine. And so you can see that, sure, there are risks to the very small, limited risk to getting a vaccine, but you look at the risk of COVID and it's much greater. And, our state health officer, Dr. Thomas Dobbs, he told everybody a couple months ago as the Delta variant started spreading, he's like, you need to prepare. You're either going to get COVID or you're going to get the vaccine. And so, there's not a third option. And so that's something to consider when you're making your choice about getting vaccinated, is you want to protect yourself from all these increased rates in red of COVID, and you'd much rather trade for these smaller rates in blue. And you'll see some of these that are actually negative numbers. That just means that the vaccine was shown to be protective against those events. So in the group that got the vaccine, there was actually less strokes than would be expected, less clotting events. So you see the vaccine is protective against several of these events, and then also compared to the virus, protective against myocarditis is a big one that everyone's talking about now, because you see there's 3 extra cases of myocarditis in people that got the vaccine, but there's 11 extra cases of people who got the virus. So you'd still rather be in the vaccine group than getting COVID group. So does that make sense?
And then the one on the bottom that the audience might take a look at, would you, it's pretty self-explanatory, but that seems very minor.
Sure, and this may be concerning to, like you said, people that are not familiar with lymphadenopathy. So our lymph nodes are part of our immune system, and so sometimes they do swell up as our body is fighting off different bacteria or viruses. And so that's something we have seen with the vaccine, is that you see there's more cases of people who report their lymph node swelling. Probably the most common area we see it is in the neck area. And so that is sort of a common thing after the COVID vaccine. But yet it's temporary, it goes away. It does not cause any permanent damage or permanent concerns.
Well, thank you for sharing that information. Very informative. So what are some of your biggest concerns at this point, Dr. Fitz, and any others who would like to take this, or what are some of the things that keep you up at night thinking about and wishing things were different, and what the public can do to help?
Well, one of the things that I think about, as I have been in practice longer and I have a larger adolescent population, our adolescents are not that healthy in Mississippi. We have a very high rate of metabolic syndrome, where we have seen a doubling in the type 2 diabetes since the onset of this pandemic. These put these kids at a higher risk. And of course, metabolic syndrome and obesity and hypertension and type 2 diabetes, it's a family lifestyle issues, a lot of things that we have to do to change our lifestyles to make ourselves healthier. I have a fear that more Mississippians are going to die because of our general unhealthiness as a population. And that these kids are going to get sick from school, and then they're going to go to their grandmother or their aunt who has autoimmune disease, and that person is going to get sick and die, even if they've been, vaccinated. Those are the people that are showing up. The unvaccinated people in the hospital have some autoimmune disease, they're older, or they're on chemo. I want to dispel that myth that it's not, those people are sick and are going to get sicker. But even if they are vaccinated, I think a lot of people are saying, well, vaccinated people are showing up in the hospital, but not nearly at the rate of the unvaccinated. And that's where I worry.
I just wanted to throw this up. This is from our local hospital, Forest General, and this is numbers as of today, this morning. And it just shows that, the majority of total patients in the hospital are unvaccinated, 93 out of 105. You see 23 out of 25 patients that are on the ventilator are unvaccinated. And like Dr. Fitz said, the patients in the ICU that are vaccinated are more than likely patients that have underlying conditions. They're on chemo, they're organ transplant patients, they're severely diabetic and have other complications that put them at risk. And so, I thought these numbers just sort of highlight that message. So.
Thank you very much. Dr. Brooks, things that may keep you up at night and concerned about children in your community and across the state in relation to COVID?
Well, kind of two things that I guess are somewhat related, and we touched on this, is the impact on our kids' learning. And is this going to be just a cycle until we finally get enough vaccinated or enough immunity, which is the hard and wrong way to do this, and especially every variant we see could potentially be worse than the last. But the impact on our kids, and they want to be in school, they need to be in school, it's good for every part of their being. And so what keeps me up is, when are we going to recognize what it takes? We want that same goal. We have kind of two schools of thought in the state because this virus has been politicized. So, but when are we going to realize that we all want that, and that we need to rise above that polarization, politicization of the virus, and do what's right for the kids to protect them, so we can get to our new normal, which, maybe some cycling, but not nearly to this degree. I mean, so many kids have already missed more days than allowed, and teachers, and just on and on. What bothers me is, when are we going to collectively realize this and what we have to do, like we have in the past. I had a grandmother mention, well, when we had the measles and all, they came to the school and gave us our shots, and we were happy to take. I said, sure. And she recognizes that. But again, of course, a lot of those diseases have been a victim of the success of vaccinations, but trying to message that to the younger generations of today is very difficult, because they can't even imagine those diseases. But we've got to collectively realize that this, aside from your political views, this is a public health issue, and we have to do what science tells us to do. And luckily or unluckily, with time, we have more and more data. And sometimes that's still disputed, but we have to rely on that, as we always have in the past, in directing the child health issues.
And as you mentioned, so many childhood diseases of a generation or two ago have been totally eradicated because of following the science, because of people taking vaccines, because of people listening to their pediatricians or healthcare providers, etc. You talked about Dr. Brooks, a grandmother. I'm not a grandmother, but I certainly am old enough to be. But I remember the little sugar cubes for the polio vaccine, and no one questioned that. We would just line up, and there you are. And these are some diseases, looking back, that we don't have to worry about in today's world for children or grandchildren or your neighbor's children, etc. So I just want to close by saying, oh, Dr. Shook, what keeps you up at night? And then we'll close in a minute.
I say that the concern over the children. I mean, that's who we're looking out for and worry about the most. And I think the teenagers, are the most affected right now. You know, they're the ones that need, I think, the most socialization. They're trying to figure out who they are in the world and who their friends are. And so for them to be, you know, at home and isolated and not being able to socialize is really detrimental to their, you know, healthy development. And so I think in order to get those forms of normal back, you know, I think we have got to look to the science and like Dr. Brooks said, put our demanding our rights aside for right now and saying, hey, we have the right to help each other, and we have the right to get vaccinated. Even though I'm not really excited about getting vaccinated, I think it's going to help my community, so I'm going to do this. And that's the part of our souls we need to really try to dig in there and find and bring to the surface. And so that's what keeps me up at night right now. So.
Well, I just want to say that as serious as this is, and it certainly is, and as much of a concern it is out there, it would be even more so if we didn't have the dedication and of each of you day in and day out providing quality care, and pediatricians and nurses and respiratory therapists and others all across the state. So you cannot be thanked enough from the perspective of myself personally, but certainly on behalf of the Children's Foundation of Mississippi for the great quality care that you do. So we appreciate your time, and we hope to see you again talking about other topics beyond COVID, and maybe we will have made so much progress by that time, but and speak about some of these other topics. So thanks again for your time. Very, very much appreciated.
Thank you for having us.
Thank you. Enjoyed it.